Gauteng's health department has confirmed a third case of cholera in Johannesburg. The department says that the latest case reported yesterday is that of the husband of the first confirmed patient. He presented symptoms at a health facility and was immediately admitted on Saturday for further tests to be conducted. For this, we're now joined via Zoom by Gauteng's MEC for Health, Nomantu Nkomo-Ralehoko. Thank you so much indeed for joining us, and welcome to the program, MEC.
Thank you for having me. Thanks. I truly appreciate this opportunity.
So the first thing is, the moment you hear the word cholera, given what happened back in 2008, people get worried and concerned. Is there still no need for serious concern at this stage, now that we know that there's a third person who's tested positive?
I think we can be concerned, but what we must do is to start educating people that indeed we have these 3 cases that have been recorded. But what needs to be done then is for us to provide this education on the do's and don'ts and what is expected of us, because the confirmed cases are the people who have traveled and attending the funeral. But what the department has done is to do the tracing in those that were with those people in the bus traveling from Malawi, because they were using a bus. So because we need to prevent the outbreak. That's our role. And how do we prevent that? Is to ensure that we check in the communities people that have the symptoms and advise them to definitely go to the nearest clinic. But on our side, we are having a program. We've activated now a program of educating the citizens about cholera, coupling it with the measles, because you remember, recently we've been having an outbreak of measles again, and we've been doing that in schools. But what we have done is to make sure that then we work very closely with the other clinics in the neighborhood, in the province, including those that are in the nearest in our nearest communities, besides the mobile clinic that we're having that goes out to the communities. And today we were in Sebokeng educating communities there in Boiketlong informal settlement and Sebokeng hostel. And we further want to plead to members to ensure that all of them, once you see that you have the symptoms, before they can become severe, when you have a watery diarrhea, you start being dehydrated, you go to the clinic, because those are the symptoms that you will find. But again, we're saying you can just, if you want to drink water, well, let's try and make our water more clean by mixing 1 teaspoon in a cup full of household bleach and in the 20 liters of water. So you add a teaspoon of water and that cup of bleach in that water, so that you can make the water more cleaner, and boil that water before you can drink it. So that's the measures that we want to advise the communities to do. But we're not working alone. We're working with the National Department of Health. We are working with the WHO, and we're working with non-communicable diseases. So all those organizations, including NGOs, are assisting us to ensure that we educate our communities, because we want to prevent the spread of cholera in our communities. Because already we are aware of the 3, but let's prevent it so that we're not having more than that.
All right, so I suppose at the moment it's encouraging in terms of control that it's isolated to one family. At what point may you get a level of comfort that it's been contained?
We'll get a level of comfort once we now don't get more than this number that we're having. At the moment, we must make sure that we are not relaxing. We make all means that we prevent. And I always say prevention is better, because the number will not grow up if we are preventing it. And the only people that must do that, sending the message, it's us as government, working very closely with yourselves, because people listen to you and listen to the radio, listen to social media. And I'm sure you have seen almost all the social media platforms, including some of the community radio stations. I've been doing interviews today, so that people are aware that this is there, and you are encouraging them to clean their areas where they live, their environment, so that there is not that running water in every space where you find in the community. Those are the basics that we want them to do.
Help us understand a little bit about this bacteria. So these people came from Malawi, I think, on January the 30th. We're now on the 9th or the 8th of January. If you've traced everybody they've come into contact with, and I'm sorry, 8th of February, if you track everybody that they came into contact with and they don't have the bacteria or any symptoms, is that the end of it once these 3 people are treated, or does the bacteria float for some time? What happens?
I think it does float for some time. That's what even the advice we're getting, that we can't stop with the 3. That's why we must continue with the education. We must insist that people must wash their hands thoroughly, even before they can use anything. And I think you remember even during COVID-19, there were those issues that we were told to practice them. And I think let's not relax. Let's wash our hands, let's sanitize our hands, wash them properly, because if we are relaxing in some of these, just the basic things of health that we should be doing, we will end up having the problems like this one of the spread. But we want to try and stop the spread by sending a message, by educating communities on the do's and don'ts.
And I suppose we need to reassure citizens that it is treatable, so that they needn't fear. They must just go straight for health inspection if they think they've got something, and they'll be treated.
You are correct. That's what we are sending, that message, that it's treatable. Hence, we have a team of nurses and 1 doctor that we're having at the moment. But not only 1 for the whole province. In the regions where we go, we always have a doctor on site and some medical assistance to some of the teams that are doing education on the specifics. But we don't want to relax, and we don't want the community to relax. We want to ensure that we encourage them so that we are able to stop this. And when there are signs, that's why we're saying, once you feel that you have a signs of of diarrhea, please quickly go to the nearest clinic if you don't see our mobile clinic in the community, because we are localizing health, by the way. That's why the mobile clinics are not only going there now as an event. They will be there amongst the communities with a group of nurses that are working again with our community health workers that are there in the communities that have been there before. And now we're emphasizing that there must be more visibility of them to assist those that are in need.
MEC, thank you very much indeed for joining us this evening. Thanks for your time.
Thank you for having me.
Thank
I
you.
truly appreciate this opportunity.
Thank you. That's Gauteng's MEC for Health, Nomantu Nkomo-Ralehoko, joining us, talking to us about this 3rd case of cholera that's been confirmed in Gauteng, in Johannesburg. But that's the husband of the first patient, so it's still contained in 1 family. But she's warning us to remain vigilant and do all the necessary health preventions like washing hands and being careful.